morning, dear friends. I am Dr. Jayashankar, Director and Clinical Lead Cardiology and Electrophysiology at the Medway Heart Institute at Kodambakkam in Chennai. I am here to discuss about trimetazidine, that is Cytogard, and its role in acute myocardial infarction. A case of acute MI in a 57-year-old male, acute myocardial infarction involving the left anterior descending artery, will be discussed. This male patient with a history of hypertension and dyslipidemia presented to the emergency department with acute onset chest pain of 1 hour's duration after dinner, which he described as a crushing sensation radiating to the left arm and neck. Despite relatively low pain rating 4 out of 10, the patient was in distress, including profuse sweating and pallor. Initial troponin levels on admission were elevated, confirming myocardial injury, and subsequent rising titers supported the diagnosis of acute myocardial infarction. The 12-lead ECG revealed ST elevation in anterior chest leads, and other findings were consistent with an ischemic event. Prompt intervention by way of urgent coronary angiography and primary PCI was done in the cath lab. The angiography revealed a 90% block in proximal left anterior descending artery, which was believed to be the culprit vessel responsible for the acute coronary syndrome. PCI was performed promptly with immediate and adequate restoration of blood flow in the left anterior descending artery by deploying a stent. The patient was discharged after 2 days with a regimen of medications which includes aspirin, clopidogrel, atorvastatin, metoprolol, ramipral, isosorbate mononitrate, and trimetazidine, which, being an antiischemic, complemented the conventional pharmacotherapy for coronary artery disease. This comprehensive management in a successfully revascularized patient addressed the underlying risk factors, thus highlighting the importance of early intervention and tailored medication strategies in case of acute myocardial infarction in a patient with a LAD occlusion. Trimetazidine has been known to relieve residual angina which persists in about a third of patients after successful revascularization because by way of its metabolic modulation. It decreases the myocardial oxygen demand, leads to favorable myocardial kinetics, energy kinetics, thus reducing the ischemic burden. Trimetazidine happens to be an important medication in the armamentarium of antiischemic therapy by virtue of its neutrality in hemodynamics. Thus, even in those patients whose hemodynamics are borderline, who are hypotensive, trimetazidine does a good job where we are unable to give other medications. Comprehensive medical management after successful revascularization. The regime can also be added with a trimetazidine to reduce the risk of residual angina, particularly in those patients where only the culprit vessel is addressed and they have other lesions which perhaps could be left on medical management. Thank you very much.